A hospital is the last place you want to be right now. So for the people that have to be here, the best thing that we can do is reassure them and reassure their families. Hi. We were lucky enough to get a couple of tablets so that we could facilitate video chats, so whether on WhatsApp, on Skype, or on Google Duo, between the patients and their families.
Hi there, how are you? Better today?
I feel stronger.
You know, we're getting a lot of different professionals like préposés or nurses or even occupational therapists or physiotherapists who are kind of flagging people to us who need a way to communicate with their loved ones. You know, we're kind of pulling from a lot of different professionals who, when they have the availability, will go and make these calls. So everybody's really pitching in, and it's a nice team effort. Tell her she looks good.
I put lipstick on for you, but I still don't look good on this camera.
No, you look good. Nothing wrong with you.
Thanks.
God almighty. Look what I married.
Everyone is very, very grateful, both like the patients and the families. They're very grateful when we're able to take time out of our days. They know how hectic things are in the hospitals right now.
This is really good.
We don't do it for the gratitude, but I mean, certainly it's nice.
I can see what progress he's made.
We FaceTimed with both of his sons. We managed to organize a three-way chat, and it was like they were hanging out in their living room, like they were planning a weekend away once he's out of the hospital and once everything is solved. So it was really fun to see. It gave him a lot of hope, and it gave him kind of a push to get through what he's going through medically right now.
Hey, take care, Jerry.
We're just trying to keep people in contact as much as possible, doing what we can.